Welcome to Hiranya Medical Service. 5 minutes to a better health by our eminent doctors.
Hi friends, I'm Dr. Anand, Chockalingam. I'm a cardiologist at the University of Missouri in Columbia, United States. It's a pleasure to meet with you. Today, I wanted to discuss about high blood pressure, hypertension, especially in the young students. For several decades, we have known that high blood pressure can be a big problem and cause heart attack, stroke, kidney failure, so many things that directly cause morbidity and mortality, which means people are sicker, disabled, and lose their life. Hypertension is present in a huge number of the adult population. About 50 to 60, 65% of population in the United States have hypertension. When we look at students, unfortunately, we are seeing increasing numbers with high blood pressure. When we ask the question, how come at a young age, when the blood pressure is supposed to be only 110 over 65 or 70 millimeters mercury, how are they developing hypertension, which is defined as over 130 millimeters mercury systolic or over 90 millimeters mercury diastolic? How come a 17-year-old who is still in school or a 22-year-old who is in college developing this high levels of blood pressure? Sometimes there may be, I would say, in 1%, 2% of the people with high blood pressure, it may be because of some blood supply issues to the kidney or a small endocrine tumor in the adrenal gland, aortic pathology, things like that. But majority of the situations, 95, 98% of the time, we call it essential or idiopathic hypertension. This unfortunately does not cause any warning symptoms. So we request everybody to have their blood pressure checked at least once or twice a year. It is very easy to do that. And if it is elevated more than 130 over 90 millimeters mercury, people will have to have medical attention. Before medicines, lifestyle can play a huge role in reducing hypertension and preventing it. The simplest tips I will think of are ensuring that we get at least 8 or maybe 9 hours of sleep when people are still at adolescent age groups. Once people are in their 20s, at least 8 hours of sleep, and avoiding mental stress, worry, avoiding unhealthy, salty foods, and exercising for about 30 minutes every day. This alone, and avoiding excess weight. Overall, please avoid gaining excess weight. This will prevent hypertension and keep us healthy throughout life. We don't have a specific genetic etiology for high blood pressure, but we do know that high blood pressure runs in families. Children and grandchildren of people with high blood pressure have a higher risk for hypertension. Based on all the evidence gathered in the last several decades, where we are now is recognizing that genetics probably contributes to potentially about 20-25% of hypertension. Then where does the rest of the 75% of blood pressure elevation currently come from? It comes from our lifestyle and the environment. So even if there is a genetic predisposition or risk for high blood pressure, we can, through lifestyle and through our connection with our community and ensuring that we take the right precautions, that we can completely avoid and much better control blood pressure throughout the lifespan. Hypertension is a silent problem. By itself, even when the pressure of 120 systolic goes up to 140, 180, sometimes 200, 220. Even then, many patients unfortunately don't have any acute symptoms. So my request is every adult throughout our lifespan, we need to check blood pressure at least a few times in a year. Otherwise, we may miss high blood pressure, sometimes for years together. So what happens if blood pressure is not detected and it runs high for some time? If it runs very high within few days, sometimes within few weeks, we may have complications like heart failure, stroke, bleed in the brain, and other emergencies. Most often what we see is when blood pressure is not recognized or not adequately treated for a period of say 5 to 10 years, the risk for atherosclerosis goes up dramatically. So high blood pressure forms the basis for kidney failure, heart attack, and strokes. So these develop over time, and we can completely avoid these things by simply checking our blood pressure and following with the doctor to ensure that over time we are maintaining the average blood pressure under normal range. Normal being in the 130 over 85 millimeters mercury range for most people.
Thanks for watching. Do like, share, subscribe and click the bell icon button to receive instant updates.